This evening, as you heard, interests of mine really are around women's health, fertility, as well as autoimmune disease and thyroid. And that's because I personally have suffered with Graves' disease and then fluctuated when I was on medication with sort of hypothyroidism as well. And there is absolutely no doubt that stress was a major factor in the cause. And also I see that with my patients as well. Before I start the talk, I would like to disclose that I am an advisor for Pure Encapsulations and that I have no other conflicts of interest to disclose. Tonight, I'm going to be sharing with you some of the foundations of thyroid function, really how the thyroid and the adrenal glands are connected, and then how stress impacts that HPA. So we're talking about the hypothalamus-pituitary-adrenal and thyroid axis. And then we're going to move on to therapeutic considerations, things that you can do as practitioners to help your patient manage their adrenal and thyroid health. So the thyroid is a gland that is found in the base of the neck, and it's really triggered by the pituitary, which is triggered by the hypothalamus in the middle of the brain. And that's why we say the HPT axis. So the hypothalamus, pituitary, thyroid. So the hypothalamus, which really is there to connect our brain, the nervous system, to our endocrine system. So the hypothalamus produces TRH, which is thyrotropin releasing hormone. That then triggers our pituitary to make TSH, thyroid stimulating hormone, which then triggers our thyroid to make the T3 and T4. So those hormones that regulate all those metabolic functions in the body. And this really works on this sort of feedback mechanism. So when the body detects that there are lower levels of T3 and T4 in the circulation, that then causes the pituitary to make more TSH, which then triggers the thyroid to make more of the T3 and T4. And then when levels get higher, this slows down. So when the body is functioning properly and things are in balance, there is this mechanism to ensure there are sort of adequate levels of T3, T4, regulating all of those metabolic functions that we'll talk about. So I think all of you, your practitioners, you know that the thyroid does so many things in the body. As I said, it's like the master regulator of our metabolic functions, but it's involved in breathing, heart rate. We can see your digestion, brain, bone health. Really, it affects all the tissues in the body. But it is very common for people to have thyroid dysfunction. And actually, it's the second most common endocrine disorder after diabetes, affecting women of reproductive age. And women are 8 to 10 times more likely to develop a thyroid condition. And we don't actually know why women are more susceptible to men. We do know that women are more susceptible in general to all autoimmune conditions. But in relation to thyroid, we do know that women most often do develop thyroid dysfunction, particularly hypothyroidism, which is a bit more common than hyper, after pregnancy and after menopause. So it may be that there is an association with hormones, because we know in pregnancy and menopause, there's obviously that fluctuation, but also it could be a difference with our immune system compared to males. And also I've said here that thyroid dysfunction is the second most common cause in women of reproductive age. I also want to emphasize that thyroid disorder is really common in women after menopause. And depending what stats you read, some people quote that 20% of women after menopause will develop a thyroid disorder. So very high numbers. I couldn't find stats for the Philippines or for Hong Kong, but here in Australia, it's estimated that 1 million Australians have an undiagnosed thyroid disorder. And in the US, they predict about 20 million people have thyroid disorders, and up to 60% of those are undiagnosed. And what I mean by that is there are people that are walking around with either subclinical hypothyroidism or they've got these symptoms. We know that it affects so many things, and sometimes the symptoms can be linked with other things. People go to their doctors, they tell them they're putting on weight, they're cold, they're stressed, and often people are not having their thyroid tested. And sometimes it takes a really, really long time to get diagnosed. I know personally, before I was diagnosed, I was very, very sick. And it is quite sad how sick people get before this is picked up. The two most common thyroid disorders are hypothyroidism. So that's when the thyroid is low, everything slows down. And the main cause of that is Hashimoto's disease. So that's the autoimmune cause. And then there's hyperthyroidism, which is a lot rarer. It's predicted to be about 1% of the population. It is hard to get adequate statistics. And the main cause of that is Graves' disease. So that's the autoimmune condition. So with hypothyroidism, we've got all of these sort of symptoms that you can see on my left. Is you all right? No, you're looking at the screen like me. So on the left, you can see all of these symptoms. And really, when we think hypothyroidism, everything is slowed down. So remember, the thyroid is regulating all these things in our body, our metabolic rate. It's so important for growth, for reproduction, for metabolism. So with hypo, everything's slowed down. People feel sluggish, they're tired, they're fatigued, they're weak, they're putting on weight because their metabolism has slowed down. They're very sensitive to cold. We often see a lot of swelling in their face. They're constipated. So things literally slow down. They're not moving those wastes out of the body. And when it comes to mood, they're often depressed and feeling quite down and sad. And we know that it's also linked with frequent heavy periods and slow heart rate. Hypothyroidism, on the other hand, is linked with a lot of the opposite. So the trouble sleeping and the fatigue, they're very similar, but it's weight loss. Everything's sped up. So hypo, it's all slow. With hyperthyroid, you know, it's a million miles an hour. They're anxious, there's a tremor, the heart rate's going, palpitations, they're hot, sweaty, loose bowels. Everything's moving through really quickly. And often one of the telltale signs, which in my case, it's interesting, it took so long to get picked up because my eyes were definitely bulging and I had a goiter. But the eyes, you definitely get this look. You can tell when someone is hyperthyroid, and they have been for a long time, because those antibodies start to affect the eyes. So what is the connection between the thyroid and the adrenal gland? Well, they are literally connected through this same HP axis. So we've got a different image here, but we're looking at the brain again, and we can see the hypothalamus and the pituitary. So before, at the beginning of the talk, I explained to you that we've got the hypothalamus, the pituitary, and then the thyroid, that HPT axis. But we also have the hypothalamus, pituitary-adrenal axis, the HPA. And we also have, which I won't be talking about today, but so you know that these are all so closely linked, that HPG axis. So looking at the hypothalamus, pituitary, and the gonads. And we do know that stress and thyroid definitely impact reproduction and fertility. So just to remind you, this is a good little diagram. You could use this one with your patients, but about the stress response. So the stress response, we're thinking again about that HPA axis. So the hypothalamus, the pituitary, and then the adrenal. So here we've got the hypothalamus. So something has triggered the brain, whether that is a tiger, because that's what the stress response is for, is to help us, you know, that fight or flight. We need to fight for our life, or we need to get away. And it's the same response, whether you have seen a tiger and you need to run, or you are stuck in traffic, or you have a work deadline, or you have financial stress, or you have COVID-19 stress. Whatever that stress is, this is the physiological effect that goes on in the body. So the brain triggers that HPA axis, The adrenals then go on to make adrenaline and cortisol. Those stress hormones are pumped out. That then changes the lungs. So there's this sort of dilation, so you can get more oxygen in, heavy breathing, getting ready to run, getting ready to fight. The liver converts glycogen to glucose, giving us more energy. And then we also have an increased heart rate. We know that the heart starts pumping, blood pressure goes up, and then other things are slowed down. Things that are not essential, like our digestion, like our reproductive organs, things get slowed down so that all of these things are working. So we can, get away from that tiger. Or what's more realistic in this day and age is, we're dealing with other stresses where we don't really need this fight or flight response being triggered. But that ultimately is what's happening in our body. So just to sort of summarize that, I've said it in the image, but stress triggers the HPA axis to produce the stress hormones, cortisol and adrenaline. We know that autoimmune diseases, Graves, which causes hyperthyroidism, excuse me, and Hashimotos, which causes hypothyroidism, are associated with chronic stress. So prolonged HPA axis activation, and what I mean by that is long-term stress, is also associated with chronic inflammation. So when you trigger, the stress triggers the adrenal glands, that also triggers the immune system. And that stress response actually is a good response that can protect you. However, it's not designed to be on all the time like it is in this modern world with so much stress. And we do know that chronic inflammation is also a driver of autoimmune disease. Also, we have this bidirectional relationship, which I'm going to explain in the next slide, between the HPA and the HPT axis, so directly between the adrenal glands and the thyroid. And we also know research has shown that stress, particularly cortisol, can suppress the release of TSH from the pituitary and also decrease the conversion of T4 to T3. So T3 is really like the active thyroid hormone. The T4 needs to be converted into T3 to do the work in the body. And ultimately, chronic stress is very strongly linked with hypothyroidism. However, I do also want to point out, and probably most of you know about that link with stress, particularly cortisol and hypothyroidism. The mechanism is definitely well published in the literature, but stress in itself is a driver of autoimmune disease. So it's also a big factor in Graves as well. So just to give you a visual of that relationship between stress and that connection between the HPA and the HPT axis, I can show you here we've got stress, which affects the hypothalamus and then the pituitary, so that HP, and then the adrenal glands. So if there is stress, what happens is the pituitary is triggered. Whoops, I've gone too far. The pituitary is triggered. That then causes cortisol to be produced from the adrenal glands. And that cortisol then actually slows down. This minus here is sort of a negative effect. It slows down and prevents this conversion of T4 to T3. And it also increases the production of something called reverse T3. So reverse T3 is like putting the brakes on the thyroid. It slows things down. In addition, cortisol, as I said in the previous slide, can slow down and actually inhibit the production of TSH, so that thyroid stimulating hormone. So there is this link between the adrenals and the thyroid. And remember, the thyroid's important for growth, for reproduction, for all of these things. And if someone's under chronic stress, they're going to be pumping out these hormones, and then that is going to affect the thyroid and slow a lot of these important functions down. So what can we do? Well, first of all, we need to help our patients and practitioners and us as well, because often we're very stressed as well. learn to manage our stress. Now, we know that stressful events are a fact of life. There is no doubt that all of us are going to deal with stress. And I always remind my patients about this because I don't want people to be scared of stress. It's not about avoiding stress altogether because that's impossible. It's about knowing how to manage that stress and also understanding that a little bit of stress is good for us. Even me doing this presentation and coming to see you all tonight, there's that little bit of excitement, a little bit of stress, you know, you're getting on and giving a presentation. But that's good stress because as I get into it, I feel a bit calmer, but then by the end, all those stress hormones go down, I get back into homeostasis, my body is working as it should. The problem is chronic stress, when we don't turn off that stress response, when people are in that survival mode, that fight or flight, because they're constantly worried, they're constantly stressed, whether it be finances or some other thing that's going on in their life. So we really need to help our patients identify what is the thing that is causing their stress. Is it a job, relationship, finances? Often with me, I work with a lot of very sick patients. I think as integrative and functional medicine practitioners, we often get very sick people that have been to so many doctors and are not getting better. And actually their health is one of their stresses. So trying to undo that and stop them from stressing about their health can be difficult. Letting our patients know that speaking to a professional is very important, but also stimulating the vagus nerve, because when our patients or ourselves, our friends, our family, when we're stressed, we are activating that sympathetic response, that fight or flight. But for our patients to get well, to take the pressure off the adrenals, for the thyroid to function properly, for us to be well and healthy, we need to have that time in that parasympathetic mode, that rest and digest, so that we are absorbing our nutrients from our food, so that we are in a place of healing, particularly for those that have an autoimmune disease. They're never going to get well if they're, chronically stressed. They need to be able to switch that off. And the way to do that is to really help your patients access the vagus nerve. So there's multiple things you can do for that. For those that aren't familiar with it, breathing is definitely one of the best ways to stimulate the vagus nerve. So if you're breathing and if you breathe out for longer than you breathe in, and practice breathing exercises, that's one way. There's also certain types of yoga. You can even get machines that can sort of attach to the ear to help stimulate that nerve. And what happens when you do stimulate the vagus nerve is, instead of having the adrenaline and the cortisol, you've got the acetylcholine, prolactin, as well as oxytocin. So these hormones are going to make you feel good. And when you think about oxytocin, we think about this as sort of the hormone of love. Studies have shown too that, having a pet, and being affectionate, hugging, all these things, just having a loving, supporting relationship can also be really helpful as well. And what is known is that people with a stronger vagus nerve response are likely to recover more quickly after stress, injury, or illness. So other things we can do aside from implementing stress management tools, getting our patients to learn how to breathe, speak to a professional if they need to, activate their vagus nerve, is definitely diet. And as functional medicine practitioners, we all know how important diet is. And when it comes to thyroid, I've definitely seen it in my clinic. I am fairly certain that many of you listening to this have probably also witnessed that when people do go gluten-free and get rid of a lot of inflammatory foods, their autoantibodies go down. It does really help with the autoimmune disease. And in some cases, not all, but some cases, particularly if someone hasn't been sick for too long, they come in and they've recently been diagnosed with, say, Hashimotos, if they'll go gluten-free, that can almost heal them pretty quickly. But it's not everyone. For some, it's a lot more complicated. But despite witnessing clinically how much of an improvement a gluten-free diet can do, the mainstream model, so conventional medicine, does not routinely advise a gluten-free diet to treat autoimmune thyroid disease. So it's not part of the conventional treatment. However, research does show a link between gluten and the production of anti-thyroid antibodies. And in most patients who follow a 1-year gluten-free diet, subclinical hypothyroidism was reversed. And this is actually a great paper here, published in 2017. And you can look at the research studies that they've reviewed in this paper. What I do with my patients is I suggest, not all, but for some, is to consider trialing a gluten-free diet for at least 1 month. And some of them will feel better, but there'll be the odd person that won't. And if I do a lot of genetic testing, so at the beginning you heard that I'm a geneticist, and I work in the area of nutrigenomics, so looking at the interaction between our diet and our genes. If I have information on their genes and they happen to have the HLA genotype that's linked with celiac, so that's the HLA DQ8, 2.5 or 2.2, if they have these genes that are linked with celiac disease and autoimmune disease, we also know they're linked with Hashimotos and Graves, I will suggest actually being gluten-free for a little longer. And just know that if someone does have these HLA haplotypes, it doesn't mean they'll have celiac. It's about 1 in 30 that have the genes that actually develop celiac. So it's having the genes, and then there's something usually in the environment that then triggers that person to develop true celiac disease. And whether that's, chemicals, toxins, stress, we don't completely know, infections, things like that, but it's usually a combination of all those things. And there's a lot we can do from a lifestyle perspective. So in addition to having a gluten-free diet, what I call is a low stress diet. Some of you out there who work with autoimmune diets, you might go with those sort of autoimmune paleo diets. There's so many, a lot of, quite restrictive diets. I talk to my patients about a low stress diet. So consider reducing gluten, consider reducing dairy, definitely sugar. Sugar's got to go. So getting rid of these inflammatory foods and then just trying to get as many foods as they can in that are full of nutrients and nourish the body. Protein is also very important for helping the body heal, supporting detoxification. And when we're thinking about the thyroid, in particular, tyrosine, so an amino acid, is needed to make those thyroid antibodies. Also, just discussing with our patients water intake. It's so simple, but lots of people are not drinking enough water. They're drinking coffee in the morning, perhaps coffee in the day, maybe even having a wine or a beer at night. And a lot of people are dehydrated. We need to flush our system. It's going to help with moving our bowels, getting waste out of the body, but also clean water. So here in Australia, I'm not sure in the Philippines and Hong Kong and different places in Asia, but I'm guessing you are similar to us. Most countries do put fluoride in their water. And fluoride is a halide, so halogens, just like iodine or iodide, which is important for our thyroid hormones as well. So if someone's low in iodine or iodide, they might then get fluoride into the thyroid, which can cause issues as well. So clean water is so, so important, particularly for thyroid health. Reducing chemical exposure in general, setting up good sleep habits. So when we're thinking about the adrenal glands and recovering from fatigue and adrenal insufficiency, the circadian rhythm is so important. And often many people are working long hours, new parents waking up with children, things like that. It's so important to help our patients work on sleep. One of the tools I give my patients is yoga nidra. So that's actually like a breathing exercise that helps people get into a very relaxed state and can actually help support sleep. And of course, all the other things that we know: no screen time at night, relaxing at night, no caffeine at night, things like that. And move your body. You know, most of us are sitting all the time, so we want to break down those stress hormones, feel good, get the endorphins, definitely exercise, and people can do whatever they want as long as they're moving and enjoying it and doing it regularly. So moving on to the nutrients. So when I think about supporting the adrenal glands, I think of the A, B, Cs, the adaptogens, the B vitamins, and vitamin C. So they are so important. And with the adaptogens, things like ashwagandha, there are other ones as well. The B vitamins are so important, as I said. So thinking folate, B12, B6, B2, vitamin C. I also like magnesium. For any of you that know about the enzyme COMT, as I said, I test genetics and look at genetic variations. COMT is called catechol O methyltransferase. It's an enzyme that breaks down our catecholamine, so those stress hormones, particularly the adrenaline. So it requires magnesium. So if someone's low in magnesium, they're going to have trouble breaking down some of these stress hormones. And the Bs are needed there too to support methylation. However, these things are not going to be able to really be as powerful as you want, and to give your patient, you know, that energy, get them feeling better, if they don't learn how to rest and relax. And for some, even though I love my coffee, I'm always reluctant to get everyone completely off caffeine if it's going to stress them out too much. But for your patients that can, and if they are struggling with their adrenals, they do need to reduce caffeine. But, you know, working with them slowly, perhaps rather than going cold turkey, and letting them know that they can drink coffee again once they're well. But if they are really sick and they've got an autoimmune disease, they've got adrenal issues, they've got chronic fatigue, we really need to be addressing that. But the rest and relaxation is really important. So again, getting back to getting them out of that fight or flight, getting them into that rest and digest, letting their body heal, giving them some time to recover, and then topping them up with these great nutrients that can support the adrenals and kind of accelerate that healing. When it comes to supporting the thyroid, there are key nutrients that are particularly needed to support and make the thyroid hormones. So we know that hypothyroidism is one of the most common issues, and iodine is often an issue there. So giving our patients enough iodine, though we also don't want to have too much, that can cause issues. So testing is always good, getting a urinary iodine and seeing what the patient's levels are, and then knowing how much to give them. Selenium is also important. Actually, selenium, zinc, and iron, all of these minerals are important in helping to convert T4 to T3, that active form. And for those that do have an autoimmune disease, there is some evidence suggesting that selenium can actually help reduce those thyroid antibodies. And that's definitely something that I took in my regime to get my antibodies down and help my recovery. And I mentioned it earlier, you know, thinking about protein intake, amino acids, because tyrosine. So thinking about thyroglobulin, having that tyrosine, and then we make the T3 and T4, that's sticking those iodine molecules onto that. And then immune support is also something that is absolutely key, because most of these patients that have thyroid issues and adrenal issues, they do have an autoimmune condition. And when I'm thinking about autoimmune and supporting these patients, vitamin A and vitamin D, they're the two big players that support your immune system. So if your patient's inside all the time, they're working indoors, they're not exercising outside, they're not seeing the sun, you definitely need to think about vitamin D. It regulates so many things in the immune system and has been shown to help reduce risk of autoimmune disease. Vitamin A is also really important. Vitamin A and vitamin D actually work together. So vitamin D, we know, turns on lots of genes, regulates the immune system, but the receptor, it actually has to bind with this retinoid X receptor, which involves vitamin A. And both vitamin A and vitamin D do directly impact the immune system. Vitamin C is also a key one, very, very good for supporting the immune system, also a key antioxidant. so helping reduce oxidative stress, which can also then trigger the immune system, and again is another one of those underlying drivers of autoimmune disease. Also, if my patients are sort of suffering with that chronic inflammation, which goes hand in hand with that chronic stress and that chronic triggering of that HPA axis, omega-3s and curcumin can be really, really beneficial. If your patients are coming into and they've got other autoimmune diseases, you know, they've got joint pain, they've got inflammation, swelling, omega-3s and curcumin offer so much benefit. They actually, from a mechanistic point of view, when you look at how omega-3s come in and reduce inflammation, it's actually the same pathways having non-steroidal anti-inflammatories. So often you can actually swap your patient's prescription medication or non-steroidal anti-inflammatories that they're getting from the pharmacy for things like omega-3s and curcumin. The only thing is they don't have such an immediate effect. Obviously, if you take an anti-inflammatory like a non-steroidal anti-inflammatory, you are going to get some benefit, you know, with relatively quickly, you know, within hours, whereas with omega-3s, you need that to build up. Someone might not notice a difference for days, weeks. Some people don't notice a difference for months. They need that to build up in the body. It really depends on the amount of omega-3s in the body. But definitely ones to think about when we want to support the immune system and we want to work with our patients with autoimmune disease. The liver is also something we want to support. We know that chemicals and toxins are such a big issue in our environment. NAC and glutathione are two important ones you can consider. I personally like to use NAC and N-acetylcysteine to help the body make the glutathione. I know lots of practitioners love glutathione, but I've been using NAC for a long time, and as someone who did 10 years in the public hospital in relation to pregnancy and fertility, there are studies in relation to fertility. There's also a lot of studies in children. I used to work with a lot of children that had sort of autism and on the spectrum. And there just does seem to be a lot more sort of research around this. But glutathione can also be really, really effective, and you are then just giving the body what it needs. You just need to think about absorption with the glutathione. Also, what can be really helpful is giving particular substances that turn on NRF. So by activating sort of NRF, what you're doing is then stimulating the endogenous, so in our body, the endogenous antioxidant system. So we have some really powerful antioxidants in our body. They're called superoxide dismutase, glutathione peroxidase, and catalase. These are really powerful antioxidants, much more powerful than having a vitamin C or eating some blueberries or sort of antioxidants from your food. So we want these antioxidants in the body to be working. They can quench thousands of free radicals per second. And there are particular products and components and nutrients that will actually regulate or sort of turn on this system. And they include things like milk thistle, also broccoli sprout, which contains sulforaphane. And that can really help your body deal with oxidative stress. And when we're thinking about these chronic health conditions, autoimmune conditions, you know, the drivers often are inflammation, oxidative stress, you know, methylation, things like that. And of course, again, amino acids, so protein being important to help with detoxification as well. The last one I want to mention that you could be considering to really help your patients recover from their disease, reverse these symptoms and get well is gut support. Some of you might be thinking, why didn't I talk about gut at the beginning? So many people jump to gut at the start. But in my opinion, working on the adrenals, working on the nutrient deficiencies, the liver, and then the gut is better. I don't have it in this slide, but a lot of people that have gut issues will go on sort of antimicrobials. I'm sure lots of the naturopaths listening, the functional doctors would sort of do gut protocols with antimicrobials, perhaps even antibiotics. And sometimes the patients really react. They have terrible side effects. Even if they do get, you know, start to feel better, what happens is that infection or that dysbiosis comes back. So by doing all of these things first and then coming in with the gut at the end, what I notice is that my patients don't have those terrible side effects. And if they do have dysbiosis or a gut infection or serious problems with their gut, once you start working with them, they do sort of truly recover from that. So when it comes to supporting the microbiome, so, sorting out that dysbiosis, we've got prebiotics and probiotics. But again, thinking about diet, which can support the gut, removing those triggers, those inflammatory foods, adding in healing foods. And another one that I wanted to share with you, which I use with many of my patients, and it's something that I still take, even though I've recovered and feel so well these days, is quercetin. So quercetin has a range of anti-inflammatory activities, antiviral, anti-carcinogenic. But I like quercetin because it's a mast cell sort of stabilizer. So any of your patients that are having issues with sensitivities to histamine, or, reacting and feeling pain with histamine foods, quercetin can help. But also, not only did I have thyroid issues when I was really sick, I developed psoriasis and also hay fever, a lot of immune things. And the quercetin relatively quickly, within a few hours, would clear up a lot of that hay fever, the sinusy, the itchy stuff. So personal experience with that one. And for the last few years, I've been prescribing it a lot. And then the other thing is we can give herbs. I'm not a herbalist. However, during my own recovery, I did a lot of research with herbs. And I have to say that these two here, for me, having Graves and being very, very sick, I was on beta blockers to stop the tremor, the nausea, things like that. And motherwort for me worked beautifully and didn't have the side effects of the beta blocker, which wipes you out. And then bugleweed is something that I know the research I did was for hyperthyroid, but for those of you, there's probably a lot of herbalists listening, this may be good for hypothyroid as well, but it definitely helps with the antibodies, getting those antibodies down for the autoimmune, and also for hypothyroidism, that bladder rack. So that's shown here, and that's full of iodine. So having, which I know you do in the Philippines, I've had some of your beautiful food, in Hong Kong as well, you tend to eat a lot more seafood, and you're probably a lot less likely to have the iodine deficiency and low levels that we do here in Australia and New Zealand, because you do have a higher intake of those type of foods. So what we need to do for our patients is develop a management plan. I've given you lots and lots of supplements, lots and lots of ideas, but we're obviously not going to give all of those supplements to our patients. We need to work out which ones do they need and when are we going to give them. So to do that, looking at the patient's symptoms, their test results. Personally, I use genetics as well, but you can get enough information from a really good case history, and then even some, basic bloods and looking at nutrient levels and things like that. Also consider their diet, their nutrient intake, food sensitivities, whether you do need to support the adrenals, what are their stress levels like? Are they struggling with fatigue? Also their liver, are they having sensitivities? One way, without doing expensive testing, without doing all the functional medicine testing, if someone is sensitive to smells, they're becoming sensitive to food, possibly even sensitive to supplements. One great thing about Pure is obviously they're so clean, because some patients do, when they're really sick, they start to react to some of the excipients in those supplements. So if people are becoming sensitive to their environment, think about their liver. Is it chemicals? Is it toxins? Is it a stealth infection? Have they got mold or something like that? And then of course gut, as I said, which I sort of tend to do after I've been working with my patients for a little while. And then the other underlying drivers. And so you would then work out, what are the priorities? Am I going to start with the adrenals? Well, then I might be giving some magnesium and some B vitamins, see how they respond to that. Then I'm going to bring in some other things. I think I need to give you a bit more thyroid support, and work out what's best for your particular patient. So in summary, Sorry, they are not popping up in order there. So in summary, thyroid dysfunction is really, really common, and particularly in women. And I think it's becoming more of an issue. And what I should also say there is that adrenal dysfunction is also a really common issue. I mean, I'm sure that all of your patients coming in, or most of your patients coming in, like mine, are complaining of fatigue. They feel terrible, and stress is one of the major causes. When it comes to thyroid dysfunction, taking medication, so thyroxine, if they've got hypothyroidism, or in the case of Graves, giving radioactive iodide or having the thyroid removed, and then generally becoming hypothyroid on thyroxine, does not heal the person or the condition. Now, I chose not to go down the route of the medical model. I did the work, worked on, you know, my diet, my stress, which was quite difficult because I'm a go, go, go person, love to take on new things, you know, want to just do so many things in this world, but learning how to relax, learning how to step back was so important in my healing journey. You know, sorting out my nutrients, sorting out my gut. And now I feel fantastic. And when it comes to hypothyroidism, I've had more than enough patients to know that we can turn this around. But unfortunately, with the model the way it is these patients aren't even told that there's a possibility to reverse their symptoms. Now, I'm not saying we can cure people. I did have a flare after I had my second child of my autoimmune, so I do need to take care of myself. But it is possible to turn these things around, but we do have to take care of ourselves. And I think that it's sad that people aren't being educated with the power of nutrition and lifestyle, because we can turn these autoimmune conditions around. Stress is a major trigger of thyroid dysfunction, but it's not the only trigger. It's a multifactorial issue, as I said during the talk. But stress is often one of the hardest to deal with. We can give all the supplements, you know, we can give really, really good quality supplements. We can, you know, talk to them about reducing chemicals and toxins and teaching them about cleaner products and all sorts of things. But learning to manage stress can be difficult, and it is something that you need to focus on with your patients, because if they're going to be stressed, they're not going to get well. Because think about that HPT, HPA axis, and then even if you're working with fertility patients, the HPG, that reproductive cycle, these are all very closely connected. And finally, for individuals who are willing and motivated to improve their health and their lifestyle, many of them can and do recover from hypo and hyperthyroidism. Plus, if your patients do this, it's not just about the thyroid. It's not just about getting their energy back, sorting out their adrenals. What we're really doing is improving lifelong health. And if that is one thing I want to do in this world, my mission is really to help as many of my patients, myself, my family, my friends, all of you, really be able to be well so that we can enjoy our time here on this planet. So I appreciate your time. I'm going to leave you with a little quote from Robert Sapolsky. Some of you may know him. Why Zebras Don't Get Ulcers is the book he wrote. And the quote is, "Stress-related disease emerges predominantly out of the fact that we so often activate a physiological system that has evolved for responding to acute physical emergencies. But we turn it on for months on end, worrying about mortgages, relationships, and promotions." As I said, you know, this is a great system, this stress response, but it's designed to come on and then turn off, not be on all the time, because that makes us sick. So thank you for listening. I am ready for questions if there are any. Hello.
Dr. Furness, before our question and answer, I think Spectrum Innovations would like to present something to our participants.
Thank you. Yes, go for it.
All right. So can...
Stop the share. There we go.
At Pure Encapsulations, we are committed to producing the most complete line of science-based hypoallergenic nutritional supplements.
We're committed to providing our doctors and their patients with safe and effective clinical tools.
We work with research-driven suppliers to innovate new products with greater bioavailability, greater efficacy.
Pure Encapsulations uses the scientific information to develop supplements with the correct dosages that provide very profound therapeutic interventions.
In a medical practice, we have to have a high level of confidence that the products have been tested and that there's scientific data to support their efficacy and use.
We believe that quality control is a science. Every step of the process is designed to prevent cross-contamination and introduction of allergens into hypoallergenic products.
Quality control is number one, and as a clinician I want a nice pure product that has what it says on the label.
I think the third-party testing is critical so I can reassure my patients.
We believe that quality control is a science. We test both raw material and finished product.
It includes a full panel of solvent residues, of pesticides. It's about over 100 compounds. And all of that testing is done through very high quality, third-party independent labs.
When considering what companies to recommend to my patients for nutritional supplements, there are three factors that are important. First, the products need to be hypoallergenic. Number two, it's important that the products work according to the way the medical literature suggests that they should. Finally, the products need to be reasonably priced and competitive with other companies. I use Pure Encapsulations because the company satisfies all three of those criteria.
I always go to Pure first because I know that there's a wide variety of supplements that they have.
We are in the business of providing physicians with products that can empower them, and we feel a great sense of pride.
So I guess we're now open for questions. We have a question here. So do you also give, doctor, thyroid hormones itself immediately, or do you start with natural supplementation first?
So some patients will need to have medication. So I'm definitely not anti-medication. I think that for some, it's actually really, really important that they go on medication straight away. And then it's about kind of weaning off that, because that medication can help them feel better very quickly. And some of these, these patients, they're struggling to get through the day. So to be able to, get onto thyroxine, have a bit more energy, get the heart rate up, all those kind of things. Or in the case of Graves, I mean, you can't, either way, it's very difficult to function. So definitely medication first for those that have a true diagnosis, not necessarily subclinical. Subclinical, you could start naturally. Yeah, subclinical, I'd start naturally, but the diagnosis, I would go with the medication. And then once they're feeling better, they've got a bit more energy, a bit more motivation, we can start working on the diet and all that kind of stuff.
Okay, thank you. How about, is quercetin safe for pregnant women?
That's a really good question. I would have to check. So I have given it preconception. I've given it to women preconception. I generally tell them to stop in pregnancy. I'm pretty conservative during pregnancy. And often, again, if we're thinking about immune, which is why I give it, I was talking about autoimmune things, most often in pregnancy, a lot of these things, whether it be a skin condition, autoimmune, the immune system is dampened, autoimmune system. So yeah, I haven't given it in pregnancy. I think it would be safe, because literally when you think about quercetin coming from foods and what it is, but I'd have to check, and it really comes down to the studies. There's good studies in humans showing that it's very safe up to about 2,000 milligrams. I generally give quite a low dose, like 500 milligrams.
Per day?
Yeah, per day, 500 milligrams, possibly 1,000, yeah.
I see. Thank you for that. And there are a lot of patients who are doing intermittent fasting, and for some women, they find it harder even to lose weight with intermittent fasting, and some studies would suggest that it's because of the increases in cortisol. So if we would be supplementing patients with who are doing intermittent fasting, what would you be suggesting as a supplement of choice?
So
Magnesium?
I definitely like intermittent fasting for the right person. If someone is sort of in that adrenal fatigue, perhaps high cortisol, stress, sometimes intermittent fasting is not the best option because it's actually putting a bit more stress on the body. And also, you know, yeah, and they might have cravings, and then they might just find it difficult to stick to that. So I think working on the sleep, working on the adrenals, like the adaptogens, and making sure they've got no nutrient deficiencies, whether that be Bs and things that have energy, and then go to the intermittent fasting when you've addressed some of those other things, because it's much easier for them to stick with it. The cortisol's hopefully gone down a little too if they're sleeping a bit better. They're not getting so many sugar cravings if the cortisol's gone down, though we can obviously give things like, talk to them about cinnamon, what's the other one, chromium for the sugar cravings and things like that. But yeah, I'd be working on a couple of other things and then get them to do the intermittent fasting, and then they're going to get the results they want because they've got a couple of those other metabolic things in place.
Yes, thank you for that. Are there other questions? I think, how about for patients who already are using antidepressants, who are using serotonin reuptake inhibitors? Are there any suggestions on when to taper down or when to try to wean them off the antidepressants? Which symptoms are we looking for, or labs?
Yeah, I mean, it really comes down to, so that's something that I would definitely be doing too with the doctor, and it's going to be definitely symptoms, probably symptoms even more than labs. And yeah, so symptoms and just knowing that other things are in place, like with these people that are depressed, if they are having, again, I'm bringing up sleep because it's so important, but if they're having sleep disturbances, you know, thinking about the chemicals and toxins. Once you've started to do all those things and they're feeling a bit better, you can be a bit more, I guess, confident. I've just opened the notes and I can see a couple of questions there. Do you want me to read it out? One about gluten-free diet and the pure cap. Do you want me to read those?
Oh, yes.
Do you see them?
I
so
don't see the question.
So it says, aside from a gluten-free diet, dairy-free diet, should we also consider removing soy and high lectins? Yeah, so that's a really good question. The lectins is something that I don't do, but I have considered in a few patients that haven't responded to the gluten-free. So if someone's not responding to gluten-free, dairy-free, then you can start to think about the lectins, but it's not something that I do commonly. Soy, I definitely don't suggest they have soy. If anyone has soy, it's not that common here in Australia. If someone does have, like, if they want soy milk perhaps as an alternative, I would talk to them about, there's a particular brand here in Australia called Bonsoy, which is the fermented soy. But generally soy is definitely not a common thing to be having here. But if you're thinking about the goiters, which a lot of people are with soy, yeah, it's just not I think tofu and things like that aren't common foods here.
Okay, so what pure encapsulation products do you use for detoxification?
So I use the NAC. So I like the NAC. There's also a product called Liver GI, and it has some of those factors that can actually increase the NRF2. So helping us trigger that endogenous antioxidant system. The only thing with the Liver GI is it does have very small amounts. Like it's only got a small amount of NAC. So I like to give the NAC on top of that to sort of support the glutathione. But they're the two that I would most commonly use.
So in addition, is supporting the body's glutathione production with NAC better than supplying the external source of glutathione for detoxification?
Supporting the body's glutathione production. Yeah, it's such an interesting question. So when I moved into the world of functional medicine, the doctor that is my mentor, he's been doing this for 30 years, he's in his 80s. He was actually the first person who also suggested NAC, because apparently there'd been studies at the time that the glutathione wasn't actually raising glutathione levels, but now there are better forms. You can get things like liposomal glutathione, things like that that are going to help with absorption, because the glutathione, they say, gets broken up to the amino acids. But if it's being broken up to the amino acids, you're then going to get the cysteine as well. So I like the NAC. As I said, there are good studies in pregnancy and on children. So I think with most practitioners, we have things that we use that work for us, but I do have some practitioners that I refer to or refer back and forth, and they swear by the liposomal glutathione and think it's much better, but I haven't used it myself.
I see. Thank you. And may I ask what supplements you personally take on a daily basis?
Oh, you can. So because I'm a woman over 40, I take the Pure Encapsulations Woman's Multi, and to be honest, I laughed when I first saw, for those of you who know it, in little writing it says down the bottom, specifically for women aged over 40. I didn't even realize I am over 40. But I like that, though it does have very high doses of the B vitamins, and for some of you, you may know things like B6 and the Bs can affect your dreams and things like that. So it's 3 capsules a day. I don't take that. I take 1 to 2. Or if I'm going through a period of stress, I will take more, because you use your B vitamins. And when I travel, which I don't do anymore, I've been home for 7 months, but in my old life, pre-COVID, when I was on a plane and, you know, going away every month and doing workshops and seminars, I also used either the Pure Lean in the packets or the women's. So they actually, Pure Encapsulations have the little like packets, little sachets, which are great when you're traveling, because you don't want to take, 7 bottles in your suitcase. But right now I'm really lucky. I got over my autoimmune condition probably the end of last year. So it's been a really good year for me, and I'm not on a lot of supplements. I'm on the Women's Multi. I've got NAC if I need it. I like liposomal vitamin C. I used to take that a lot when I was traveling, and it's good for skin. Oh, and then the other one I take is the collagen, the hair, skin and nails. I have the hair, skin and nails from Pure Encapsulations. You need that when you're over 40.
Oh, thank you for that.
Yeah.
Okay.
So they're my ones. Yes.
That's a very good recipe for health and beauty.
Yeah,
what advice will be for patients with no more parathyroid surgically?
So what advice will be for patients with no more parathyroid surgically? So can you explain a little bit more?
It's the one who...
Okay, there.
For people who patients who had no more, thyroid surgery, and in the process, the parathyroids were also removed.
Yeah, so they've had
surgical.
They've actually had thyroid surgery because they've had thyroid cancer or, hypothyroid. They've actually physically had it surgically removed.
Yeah.
Yeah, I haven't, I don't know the answer to that one. I haven't had a patient who's had that removed and had to deal with that. Sorry, I can't give you much more information there. I'm happy for you to add in a comment of what you think or what you would do to learn from you as well.
Mm-hmm. Okay. The test for reverse T3 is quite expensive here in the Philippines. In what conditions would you definitely request for it? Would you give iodine and tyrosine even for hyperthyroid patients?
Ooh, such a controversial question. So I'm obviously talking to practitioners, not patients. So, I'll be open with you. I don't know what the regulations are there, but in Australia, it's definitely told do not have iodine if you've had, you know, hyperthyroidism, even for women who are getting pregnant. So our clinical guidelines say that women should be having 150 milligrams of iodine, but if you've had hypothyroidism, they say don't. I did have iodine when I was pregnant because, you know, you need that for the baby's brain. And also the women's multi I have has got some iodine in it. So if I followed the rules, I wouldn't, because they say people with hypothyroid should never have it. But I think it all comes down to levels. And I tested my iodine, which I haven't done for years. But when I did test, when I was sick, I was low. I was deficient in iodine. So I think if someone's low, and people can be, they should have it. So thinking about the levels, the intake, things like that. So I do occasionally give iodine to people if I know they're, so here it's a urine test. It's about $50. It's not too expensive. I'm not sure in the Philippines. The reverse T3, we're a little bit the same. You can't get it on Medicare. People have to pay. It's not too expensive. But if you think someone, obviously this is different to hyperthyroid. If you think that someone is hypothyroid and their TSH and things are coming back normal, then it's too expensive to get the reverse T3. But you know they've got high stress and they've got symptoms of hypothyroidism, they're probably going to have reverse T3. So you can kind of make an assumption and say, well, this is what cortisol does. You've got the symptoms of hypothyroidism, even though your TSH is okay. Let's think you've got subclinical hypothyroidism, and then let's, work on the lifestyle, on the nutrients. You can still go ahead with your protocol without having that result.
I see. And then how do you address Hashimoto's thyroiditis using the integrative way?
So I actually address both Hashis and Graves in a very similar manner, because both of them do have stress as a major trigger. So thinking about stress management, I mean, it's such a big issue for so many people, just learning how to switch off, learning how to sleep properly. So, it's from an integrative way, we are sort of integrating the lifestyle, the things I mentioned. So, getting them to be physically active. I mean, if they've got Hashimoto's and they're so fatigued and they're swollen and they're tired and they can't exercise, then obviously they can't. But, giving them, thinking about other things, if they can't move their body too much, baths with Epsom salt and magnesium, massage, things like that, that's going to help them get into more of a relaxed state. And then, of course, working on all the things we mentioned, the gut, the liver, the diet, all of these things together. And often it's not one. With Hashis, I've actually had some patients diagnosed with Hashimoto's and then go gluten-free and recover very quickly. But that's, as I said, that's definitely not everyone. Most of them will be, actually, I'm in the process of developing a 12-month course, which sounds like a really long time. But the reason I'm developing a 12-month course is because I think I need that long to really turn everyone around. 3 months, maybe a bit of a difference. 6 months, some people are better, but some people, to really turn their whole lifestyle around and, turn that sort of autoimmune condition off, you need a long time. And that's because people take time to change their habits, changing your diet, changing your lifestyle, all those kind of things. They do take quite a while.
Takes time. So cruciferous vegetables are the main sources of sulforaphanes, which activates your NRF2. Should we be careful about giving this with patients who have thyroid imbalances?
Yeah, so I know that things, like broccoli, cruciferous vegetables, they're thought to be a problem with, goiters and thyroid, but I don't stop patients if they can tolerate these foods, because I also work with a lot of patients that are quite sensitive to certain foods, but if they can tolerate cruciferous vegetables, I definitely get them to eat it, because they do have the sulforaphane, the broccoli, the Brussels sprouts, the cauliflower. They've got so many good things, the sulfur, so sulfation for phase 2. but some patients will be sensitive, and they won't be able to tolerate these things. But the ones that can, a bit like the iodine, I don't necessarily tell everyone to go off that as if they need it. But yeah, so I'm happy for my patients to have cruciferous vegetables. I'm generally getting my patients to eat as many foods if they're not sensitive. I mean, if they're having serious food sensitivities, yes, we go down the restrictive diet, you know, the elimination diet. But if they're not showing any food sensitivities, I'm trying to get them to eat as many colored fruits and vegetables and get as many nutrients as they can from their diet. Of course, we have the supplements as well, but you know, there's all these compounds in the foods that are so important for healing.
How do you deal with a patient with multinodular non-toxic goiter?
Yeah, so, you know, with the goiters, you know, I, in my experience, I'm not sure if someone wants to comment, I have actually found that when people do get well, the goiter just goes away, and it's really the same. I don't have a different protocol. So there's not a different protocol. It's actually the same foundations for Hashimoto's, for Graves', for adrenal, for, you know, things like this. It's getting the lifestyle in check, addressing the nutrient deficiencies, and then the body starts to get well. It functions like it should.
Okay. So in general, for thyroid hormones, do you just use levothyroxine alone or both T3, T4 in your experience? What is the best immune modulator for autoimmune thyroiditis?
So I would prefer that patients were often on T3 and T4, but here in Australia, that is not so easy to do. It's a bit like the testing. It sounds like you're the same. You know, they want you to only test TSH. To then test, you know, T3, T4, reverse T3, it can be difficult here. Often patients would have to pay for reverse T3. But yeah, I generally would like T3 and T4, but there are restrictions, and most patients will be on T4 because that's just what conventional medicine wants you to do.
Yes. Would thyroid, yes.
Sorry, continue.
Would thyroid problem have an indirect effect on potassium metabolism? Example is idiopathic hypokalemic attacks.
Yeah, I think thyroid actually has an indirect effect on not just potassium metabolism, but you know, other minerals, and it's actually well documented, not just the minerals, but because it is actually affecting, you know, we have the thyroid receptor in all of our cells. It's actually affecting, you know, all of our organs, all of our tissues. That's why there's so many symptoms. And yes, I definitely think it can have an impact on potassium metabolism. But one thing too, for those that know a little bit about methylation, it also affects the production of the active form of vitamin B2. So not just the minerals, but also some of our nutrients. So these patients, I didn't say it in there, but or maybe I did, the hypothyroid patients will definitely need to up their Bs, think they're getting enough, make sure they're getting enough of the B2, because they'll often also have really high homocysteine. And then that then influences methylation as well.
I see. Thank you for that. Okay, I think we have answered